Hello, nice to meet you. I'm Dr. Matt. I'm going to do your cranial nerve examination. Can you please verify your date of birth? Okay. And your last name? Okay, so I have your file here. And do you have any allergies? Okay. Any allergies to medications? Tylenol. Okay. And what seems to be the problem today? What's going on? Okay, I'm just gonna go ahead and type this in. For how long have you been having that type of pain? 3 months. Okay. And is it constant or it comes and goes? Constant. Is it worse in the morning, afternoon, after certain activity? So it's worse when eating. Okay, with eating. And is speaking for you sometimes difficult? It is. Okay. All right. Have you noticed any numbness around the mouth when that happens? Or anywhere else on the face? Okay. And are you taking any medications on a daily basis? Okay. How many milligrams of that? Is that once a day? Okay, do you take it in the evening or morning? Morning. Okay. Alright. I'm gonna go ahead and put gloves on. I'm going to take your temperature. This will go on your forehead. .1. Okay, and let's go ahead and check your oxygenation. This will go on your index finger. Perfect. Alright, oxygenation is 99 percentile. On room air, and heart rate is 77. So there are no worries about that. Okay, let's go ahead and listen to your heart. Is it okay if I put the stethoscope under your shirt? And breathe normal. Okay, good. Heart rate is within normal limits. Rhythm is also normal sinus. I can hear only S1 and S2. No S3, no S4. Go ahead and listen with the bell. See if I can hear any murmurs. Very good. Alright, go ahead and take a deep breath in for me. And breathe out. Good. And again, take a deep breath in. And breathe out. And again, take a deep breath in. And breathe out. And again, take a deep breath in and exhale. Okay. I'm gonna take your blood pressure too. This will go on your arm. Is it okay if we try the left arm today? Okay. Good. Just hold it like that. Okay, now I'm going to put the stethoscope right here on your elbow. Okay. Blood pressure just a little bit elevated, but it could be because of the pain that you're having. Okay, I'm gonna go ahead and just slide the blood pressure cuff down. Very good. Okay, blood pressure is 125/91, so your diastolic is a little bit elevated. And on a scale of 0 to 10, how would you rate your pain right now? It's about a 7. Okay. I'm gonna go ahead and check your vision first. Okay, for this I'm going to ask you to look right here straight at my nose. I'm going to flash a light in your eyes and it's going to be a little bit uncomfortable. Just go ahead and keep on looking at my nose. Good. And on the other side, keep on looking at my nose. Good. And now from above, keep on looking right here. Okay, same thing, keep on looking straight. Alright, now I'm going to ask you to look here at my fingers. Good. Okay, and now look to my right fingers. Okay. Can you please follow the light with your eyes only? Don't move your head. Good. Okay, and now follow the bright light. Same thing. Keep on looking at the light. Perfect. Okay, now I'm going to need you to look right here. And now look right here. Okay, very good. What I'm going to do now is I'll ask you to look straight at my nose and I will move your head, slightly left and right. So I need you to relax your head and your neck, okay? But you need to keep on focusing on my nose or on my eyes. Just find a point of focus. Okay, ready? So relax. Okay, one more time. Okay, so I did not see any deviations in your vision. There's no rhythmic changes of your eyes shifting left and right, and your pupils are running reactive to light, which is a very normal sign. Okay, Now I'm gonna need you to cover one eye, okay? And I'm gonna need you to read some of these letters. Alright, can you please tell me what color this is? Blue. And what color is this? Green. And what about this one? Red. Okay. Can you read all of the lines? No? Alright, let's go ahead and start with this one. Can you tell me what letter this is? Good. And what letter is this? Okay. And what about this one? Okay. Can you read this letter? Good. And what about this one? Good. And what about this one? Alright, let's go ahead and switch eyes. So now cover the left one. And about the same thing, can you please tell me if you can see this letter? Okay, what about this one? What letter is this? Okay. And what about this one? Okay. Can you read this row for me? Very good. And what about this row? Can you start from first letter to the right? Okay. Alrighty. I'm going to check your facial sensation. For that, I'm going to ask you to close your eyes. Okay? Go ahead and close your eyes. Good. And what I'm going to do now is I will touch you with kind of a sharp object, but don't worry, this is not going to feel painful in any way. You're just going to feel me poking, so it's going to feel just like this. Alright? And I'm going to show you first on your chest how exactly it's going to feel like so you know how to recognize it. Okay. Go ahead and tell me if you feel left or right. Good. 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 Okay. And now I'm going to introduce sharp or dull textures. This is what sharp is going to feel like. And go ahead and close your eyes. I want to show you on your chest how it's going to feel. Okay? Good. And then this is going to feel dull. So I'm going to show you what I mean by that. Okay. Go ahead and close your eyes and tell me if you feel sharp or dull. No. Sharp. Dull. Dull. Sharp. Dull. Sharp, sharp, dull, dull, sharp, sharp, dull, 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 sharp, 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 dull, and dull. Okay. Normal responses. I don't think you have any problem recognizing the textures. Now, I'm going to use the neurological hammer to kind of trigger a trigeminal response. So what I'm thinking is that you might have trigeminal neuralgia, which is a pain due to some problems and inflammation of the trigeminal nerve, which goes right here. It has 3 ramifications. One goes through the eye, which I can say that it looks very good. The other one goes to the nose. We still have to check that. And then the other one goes down the jaw. So we checked facial sensation around everywhere. And now we have left smell, taste, and neurological responses. Okay, and also a little bit of the hearing. Okay. For this, I'm going to ask you to again close your eyes so that you relax yourself and you relax your muscles. Also relax your jaw, because I'm going to put 2 fingers on it and slowly tap. Okay, so that was a good response. Now can you please turn your hand that way for me? Okay, so just hold it like that. And I'm going to tap right here in front of your ear. Let me know if you feel any kind of pain. Any pain? Okay, we'll do the same thing on the other side. So go ahead and I'll just turn your head the other way. Good. Same thing. Not see anything abnormal. I'm gonna go ahead and tap on your forehead too. Okay, any pain as I'm doing that? No. Okay. I'm gonna go ahead and check your mouth. Can you please give me a big ah? Ah, good. And just stick your tongue out better. Okay. Nothing's swollen. It looks symmetric. Okay, can you please stick your tongue out for me? That's perfect. And now can you please smile and frown? Buff your cheeks. Keep them buffed for me, please. Don't let me unbuff them. Okay, very good. Now go ahead and lift your eyebrows up. I'm gonna try to push them down. Don't let me do that. And on the other side, lift them up. I'm gonna try to push them down. Don't let me do that. Okay. Now I'm gonna ask you to turn your head this way and try to resist my force. Okay, I'm gonna try to push you back. So you look this way. I'm gonna try to move your head that way. So I'm gonna both use our forces here. Okay, that was Good, reflex. And same thing on the other side, okay? Push, 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 push. Okay, that was good. Now can you please stick your tongue through the cheek? Okay, and on the other side. Okay, can you please clench your jaw? Clench, 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 clench. And now relax. And clench again. And relax. And clench again. And relax. Alright, go ahead and slowly open your jaw. Good. Now go ahead and close it. Slowly open your jaw. And close it. And one more time. Slowly open your jaw. And close it. Alright, so I did hear a click. One last test that we're gonna have to check is through the ears, okay? I'm going to put 2 fingers inside your ears, and I'm going to ask you to slowly open your jaw and then close it again. Alright, so go ahead and open and close. Good. And open and close and open and close. Good. Alright, so I don't know if you heard, but there was a clicking, and we did hear that popping sound. It was on both sides, so that is very reassuring. Even though you have more pain on this side, the imbalance is coming from both sides. Okay. I'm gonna go ahead and put 1 drop of this on your tongue, and I need you to identify it, okay? It is very important that we find out if there is any abnormality with your sense of taste. Go ahead and open your mouth, stick out your tongue so I can put this drop. Good. And what does it taste like? Watermelon. Okay, that was good. Let's go ahead and try one more. Okay, I'm just going to put 1 drop on your tongue, same thing. And what does that taste like? Pineapple. Alright, so no issues there. Okay, I would like to take a look inside your nose now. Can you please look up for me? And I think we also have a problem here. Let's go ahead and check your other ear just to make sure. Okay. Yep. Just like I suspected. Your glands inside your nose are a little bit inflamed. It is allergy season. Now that could trigger some pain around the face, the one that you were describing. And let's see how your smell is, okay? Okay, so I'm gonna go ahead and ask you to close one ear. And can you please breathe in and breathe out? Good. What does that smell like? Coconut? Okay. Okay, go ahead and now close the other ear. And what does this smell like? Vanilla. Alright. That was good. No issues there. Alright, I'm going to check your ear canal as well, and then I will check your hearing. Alright, so I'm gonna have you look this way for me. I'm just gonna help your head tilt a little bit, and let's go on and take a look inside this ear canal. Experiencing any pain here? Okay. Doesn't seem like there's any inflammation. Okay, tympanic membrane is pro-gray on that side. Let's go ahead and check your other ear now. And same thing on this side. No signs of infection. Tympanic membrane is pro-gray. Okay. There are no signs of any neurological abnormalities. What I'm going to do is I will create a vibration sound and I'll put it behind your ear. I need you to tell me when you don't hear this sound anymore, okay? Go ahead and tell me when it stops. Stopped, okay? Can you still hear it now? Okay, that's good. And same thing on the other side. Tell me when it stops. It kind of stopped. Okay. And can you still hear it now? Okay, that's good. Now go ahead and tell me which position here is louder, position number 1 or position number 2. So this is position number 1. And this is number 2. Okay. And what about this one? This is position number 1. And this is number 2. Okay. So both number 2. I'm going to perform a whisper test now. Go ahead and close your eyes and repeat the words that I'm whispering in your ears. 1979. Okay. Gemini. Good. June 1st, 2021. Okay. March 3rd, 1885. Okay, perfect. Okay, well, I could not finalize the exam because there's not a lot that I see that may be wrong with you. What I'm going to do is I'll send you for a CT scan of the head and neck just to double check and make sure that there's nothing else going on with you. Otherwise, do you have any questions for me? Okay. Alright. No worries. Let's go ahead and write everything that we did today. Okay. And if you have any concerns, don't hesitate to give us a call and to book a second appointment. Sounds good. It was very nice to meet you. I'll see you soon.